Hello everyone. I am going to be making the video for the genetic screening counseling session. This is actually the second video or third video I guess that I've made now. Kaltura hasn't been working very well for me, so I'm using the recording function on my computer. Unfortunately, with this recording function, I'm not able to show you like a screen mirror, or at least I can't figure out how to do it. But on the Kaltura video, I was able to do a screen mirror and kind of go over the pedigree with the patient. So I guess I'll just talk through the pedigree when we get to that point, and it'll be linked in the discussion board along with this posting, hopefully. So I guess I will go ahead and get started. Hi, my name is Kaylee. I'm going to be your nurse midwife student for today. I understand that you are here for your first visit for your first pregnancy. It looks like by exact LMP, you are about 8 weeks along, 8 weeks and 1 day it looks like. First, let's go over how you've been feeling and if you have any questions about that. And let's move into some questions and some information about genetic counseling and what some options are for you. Do you know anything about the genetic screening that we are able to do? Okay, and let's go ahead and go over your family pedigree. So a pedigree is essentially, the one that I made up is a 3-generation compile of your parents and your parents' parents. So it looks like none of your family necessarily has any medical history from what I can see and from what you've reported. So you can tell your grandparents are going to be the very top people on this pedigree, and then they each have branches down into your mom's side and your mom's sisters, or your mom's sister and brother, and then your father's side and his sister and brother. And then it also goes further down to talk about you, your brother, and your 2 sisters, and how all of that links together. One thing that I will say is this is just for your side of the family, and I understand that you don't necessarily know a lot about your significant other's family history, so it would be really great if we could get some of that information maybe for the next visit, and we could determine if his side of the family has any genetic variations or any history along the medical side of his family. So moving on, let's talk about some options that you have and what we offer in the practice. So since you don't necessarily have any medical history or genetic history that would send red flags for we definitely need to do some type of screening, these are all options, and if you want to go home and talk with your significant other about it before you decide if you want to do it, that would be perfectly fine. All of the 3 that I'm going to talk about today are actually best done between 10 and 14 weeks. So what we would probably do is send you home today, let you talk about it, and then bring you back in a couple weeks to do your initial visit where we do your head to toe, and we will do a PAP if you're due for one, which you are 22, so if you've never had a PAP, then we would do one at that visit. We would also, because of our facility, we would run a gonorrhea and chlamydia off of the PAP, and we would go over some of the options such as centering that we have here as well, which we'll talk about more of that later. So the 3 options that we have for genetic screening, and I want to stress that these 3 options are just for screening. If one of these options, if you choose to do them, and one of them comes back positive, it doesn't necessarily mean that your child has whatever they came back positive for. It just means that maybe we should do some more investigation. Okay, so the first one that I want to talk about is called aneuploidy screening. And that is a blood draw that tests for your serum. It's called PAP-A and HCG, and it relates to your age, your weight, and your gestational age, so how many weeks pregnant you are. And this will test for trisomies 21, 18, and 13 in particular. If it's increased, that just means that you're at increased risk of having one of those trisomies. So if any of these come back as an increased risk, if you decide to do them, you would come back to us. We would discuss what it means, and then we would decide if we need to do something further and more definitive, such as an amniocentesis, which is where we take a needle, and you would probably see a maternal fetal medicine doctor for this, but we would take a small, tiny needle. It's a very simple procedure, but the small needle goes through, it collects some of the amniotic fluid around baby, and it tests the genes in that to see if we can get a definitive diagnosis on whether your baby has one of these abnormalities. So that first one is a blood test. The next one is called nuchal translucency, and it's also done between 10 and 14 weeks. It's an ultrasound that looks for over 3 millimeters of fluid retention. Increased fluid is an increased risk for trisomy 21 and other trisomies. So again, another screening test that is an option. And then there is the NIPT, which also tests for trisomies 13, 18, and 21. And it's another blood draw done after 10 weeks, like I've said before. And it tests for it tests the maternal blood, but it tests for fetal DNA. So it's just testing that DNA that's in your blood for whether you have an increased risk of one of the trisomies. So these are your 3 options currently. Do you have any questions about those, or can I explain anything better for you? And if not, I always suggest to my patients that they check with their insurance to see, I can give you write down the specific names of these tests. I always suggest that you check with insurance to see if these are covered, or if they're not covered, what you can expect, because sometimes they're not covered and then you get hit with a big bill that you weren't expecting. And that way you can at least plan for that, or talk to your insurance and try to figure out some type of coverage or maybe payment plan if it is something that you're very interested in doing. I just want to go over a couple of risk, percentages for you for this pregnancy. So considering that you are in between the ages of 20 to 29, your risk for trisomy 21 is actually 1 in 1,100. Your risk for trisomy 18 is 1 in 1,100. And your risk for trisomy 13 is 1 in 20,000. And then your risk of any aneuploidy, so any genetic variation that might come up on one of these tests, is 1 in 385%, or 0.26%. So less than 1% for any of them. So if you don't have any more questions and you feel comfortable talking to your significant other about it, then we can go ahead and just plan for you to come back in a couple weeks, sometime between 10 and 12 weeks, whenever works for your schedule. Try to get your significant other's family history. That way we can go over that as well. And you just let us know if you want to do any of these screenings. Thank you.